We're here at Posthuset in Stockholm for the 2023 BioStock Investor Meeting, and I'm joined by Peter Ekolind, CEO at CombiGene. Welcome, Peter.
Thank you. Thank you very much.
It's good to have you here.
Thanks.
Well, for those who are not aware, could you tell us a little bit about CombiGene and what you do?
Well, CombiGene is a company who is developing assets from researchers and small companies in gene therapy, particularly. So we take the assets and we develop the preclinical package to a kind of proof of concept, and then we try to out-license it to big pharma for those to continue with the clinical development.
Mm-hmm. And could you tell us a little bit about your pipeline?
Yeah, currently we have 4 projects in the pipeline. One is the oldest one, the CG01, which is actually the start of CombiGene. It was a discovery made in Lund by researchers for treating of partial epilepsy. And that has been developed to a gene therapy product. But it also has been out-licensed to Spark Therapeutics quite early in the process in 2021. So that project is now owned by Spark Therapeutics, you can say. The other gene therapy project we have is CGT2, which is a treatment for a very severe and deadly disease called partial lipodystrophy. And that is in progress right now, and we are doing some extra studies for that project. So we have to come back to that later on. But the newcomer in our portfolio is it's actually a program. It's called COSI, and that's for treatment of severe pain. And COSI consists of one peptide and also a gene therapy that makes the cells in the body to produce the same peptide. So we have the same mode of action in the program.
Well, and that actually is a good segue to my next question. You talked about partnerships. That's a big part of your business model. And regarding the COSI project, you are partnered up with Zynero, correct? Could you tell us a little bit more about this partnership?
Well, it is a joint partnership, which means that we have a 50-50 partnership. We share the cost 50-50, and we share also the forthcoming revenues 50-50. And Zynero is a Danish company. And that's also why we have the name COSI, because it's CombiGene and Zynero. That's the explanation behind that. And the program is a continuation of research done by researchers at the Copenhagen University.
And you also mentioned your partnership with the US-based Spark Therapeutics. Could you tell us maybe specifically how much that ongoing collaboration is worth?
Oh, that's a good one. Well, it consists of several milestones. And the first milestone, the first pre-treatment, we have already received about $8.5 million. But then there are several more milestones to come. And in total, that's $328.5 million. And if the product comes to the market, then also there is a possibility to have revenues, royalties from the revenues later on.
And you have recently started your position as CEO at CombiGene. Just quickly, how does it feel to be heading this company?
Oh, it's a good question. Thank you. I like it a lot. CombiGene is a very nice company. It's a small company with some 10 people, but the staff and the members of the team is very skilled and professionals in what they're doing. So I liked it a lot.
And finally, looking forward, what are some of the main milestones that you hope to achieve in, let's say, the next year?
Well, the next year we hope that we will move forward in the COSI program, and we have already last week announced that we have set up the CDMO. We have chosen the CDMO, and we look forward now to make another choice of the CRO for the tox study. So we're aiming for moving on to the tox study, and after that we can prepare a package for clinical applications. And we also need to work more with the COSI-02, the gene therapy project, to develop that further. For the Spark it's a collaboration, they are now more and more taking over, and we are supporting them as much as we can. For the CGT2, we need some results from some additional studies that are ongoing at the moment.
Great, so a lot to look forward to, and we definitely look forward to following CombiGene in the coming months. And thank you so much for joining us for the event today.
Thank you very much. Thanks.